Okay, which of the following is the most appropriate initial treatment for this patient? Insulin, oral hypoglycemic agent, IV fluids, electrolytes, glucagon, steroids. So some sort of endocrine, maybe diabetic picture. 24-year-old woman. She has type 1 diabetes. She presents to the ED with polyuria, polydipsia, fatigue for the past 2 days. She has been feeling unwell and has been unable to keep any food down. Her vital signs show tachycardia, hypotension. Lab results show hyperglycemia, anion gap, serum ketones. So pretty classic diabetic ketoacidosis picture.
Good.
What do you want to do first? You always give fluids and the electrolytes.
Good. Okay, so talk to me why talk to me, explain to me kind of this is an exercise. Why didn't you pick insulin therapy? How did you know to pick C instead of, I mean, there's a lot of good how do I say this? A lot of good answer choices here, but how did you choose between A and C?
Yeah, I think in a like a DKA picture, especially when they're hemodynamically unstable, right? Tachycardia and hypotension, the first step you always want to manage their fluids first before you start any sort of like insulin therapy.
Good, good. Yeah, and I would also expand this out too. Don't just pigeonhole yourself on saying, oh, this only happens with DKA. This happens with almost every medical issue, right? Um, fluids, right? I mean, you got to be thinking about how to stabilize the patient, whether it's medical, whether it's trauma, whether it's whatever specialty that you get a question for step two. You always got to ask yourself, is the airway secure? Do they have enough fluids? Things like that. And then you can start, once you've stabilized the patient, then you want to conquer, how do I say this? You want to approach their medical issue. You want to approach their surgical issue, right? But if they're not stable, then you're kind of jumping the gun, right? So one of the main things you want to think about is fluids and airways